Hello, what's up, and welcome back to another episode of A Needle in a Haystack, a behind-the-scenes account of a mucosal melanoma survivor. I'm Chris White, mucosal melanoma survivor, thriver, advocate, inspirational speaker, and self-published author of Killing Cancer with Tills. Y'all know the drill. Real quick disclosure, I am not a medical expert. I am only an expert on my story and my experience. If you need any medical advice or help, please seek out your care team. Let's get started. All right, so now we're on episode 10, picking up from episode 9. All right, it is now January 2019. I have my upcoming 6-week follow-up scans to go see my specialist, doing full body CT with and without contrast, brain MRI, and I also had scheduled another follow-up ultrasound to go over some of those nodules that were near and around my groin and my scrotum, like I did the prior time I was down there in November of 2018. Also, before we went down there, we did make some notes, and what I referenced to as my mom's Bible of my cancer story, or at least for a good part of it. And, so some questions that we had on the prior visit, they were able to confirm my gene mutation. I was not BRAF positive, no c-KIT, no NRAS, but I did have a CDK4 mutation with an MDM2 amplification. And so we had made some notes to inquire about, other clinical trials and specifics leading into that. And I also want to point out that we do have a note in here to follow up and ask about TILs. There is a note in the system that did mention, if we had harvested for TILs or not. And so if you remember back from episode 8 from December of 2018, my younger sister and the support group had connected with some folks, and that's where that was first brought up. And so we also made a note to follow up on that and to see where that would go. That is also the first time now, looking back at it, that I ever had heard of adaptive cell therapy or just cell therapy, period. So anyways, we're going to go over the brain MRI, the ultrasound, and my CT results. Let's rock. All right, so we had drove on down to Houston on January 9th to start doing some of my tests. We had the follow-up appointment the next day on the 10th. First one's the ultrasound, the scrotum and testicular area. And first thing off the bat, thank God, under impression, no intratesticular masses. Number 2, superficial hypericonic nodules along the skin and subcutaneous tissues of the peritoneal region and right scrotum, probably metastatic melanoma implants. So we already know that I have metastatic melanoma, and the more concerning parts, obviously are the ones that are within my organ. So having some other areas that I can physically see and notice, down in my groin and that kind of private area, just wanted to follow up, but all is good. Under the findings, it goes in to describe the actual size of those parts, but it definitely says normal flow within the regions, and essentially everything is all good. Do want to note at the end of the report, it does say hypoechoic nodules are identified along the superficial subcutaneous tissues, skin of the perineal region, and the right scrotum, some of which internal vascularity on color Doppler interrogation. These probably represent metastatic melanoma and correlate with the findings on the prior PET CT. So, once again, I'm starting to, point out and highlight a lot of the themes and takeaways, and why I'm doing a lot of this is that was a concern for me going into everything that I can physically notice. I can't physically see necessarily all the parts within my abdomen and my torso that I know are there, but I can't actually see them. I don't look sick necessarily, but these other parts and pieces I can. And so just to make sure all is square, I had an ultrasound and followed up on it. Next up the bat is my brain MRI. First thing off the bat, thank God, impression, no evidence of intracranial metastasis. That's always a phenomenal thing to hear, and definitely want to point out that, yes, every time I was going down and getting scans, I was also getting scans of my brain. And that was from the get-go, from the very beginning. When it comes to melanoma, it is very common for sites of metastasis, once it goes throughout your organs, to also metastasize to the brain. So you want to stay very vigilant on, keeping up with your scans and following up on that. And that way, if by some odd chance, that you do get a metastasis to that area, you can act immediately and get it treated. But to further continue, this one was compared to the prior brain MRI on November 27, 2018. The findings is there is no abnormal intracranial enhancement or signal to suggest metastasis. There is no acute intracranial finding. There is no significant mass effect. Hydrocephalus or extraaxial collection. The major intracranial flow voids are patent. The globes and orbits are unremarkable. The calvareal bone marrow demonstrates no focal abnormality to suggest osseous metastasis. And also, once again, if I butcher any of this terminology, my apologies ahead of time. Like I said, I'm not a medical expert, and I'm not a trained radiologist of any sorts, so I'm just trying to read it like you. Okay, and here we also have the CT of the chest, abdomen, and pelvis done on January 10th, 2019, compared to the PET CT done on November 27th, 2018. Here we go. These are the results. Impression: progression of metastatic disease with enlarging metastasis in the lungs, liver, and groin, peritoneum, right retroperitoneum, and left paraspinal region. Enlarging mediastinal hilar and right external iliac lymphadenopathy. Narrative, full result. Is, it goes on to say the examination of the CT abdomen and pelvis, clinical history, metastatic malignant melanoma, indication melanoma, compared to the PET CT on November 27, 2018. All right. Findings: chest. The visualized thyroid is unremarkable. A 1.4 by 2.6 centimeter left paraspinal nodule at the level of T2 is increased from 1.2 by 2 centimeters. Previously and likely represents metastasis. Series 3, image 15. A 1.2 centimeter right paratracheal lymph node is newly enlarged. Series 3, image 18. Multiple additional enlarged mediastinal and hilar lymph nodes are present. For example, a 1.3 centimeter AP window lymph node, image 43, a 1.5 centimeter left hilar lymph node, image 56, and a 1.8 centimeter subcarranial lymph node, image 58, and a 1.3 centimeter right hilar lymph node, image 7. These are in keeping with metastasis. Multiple bilateral pulmonary nodules are present, increased from previously. A 1 centimeter left upper lobe nodule is increased from 6 millimeters, previously series 4, image 29. A 2.2 centimeter right upper lobe nodule is increased from 1.2 centimeters, previously imaged 41. Innumerable additional nodules are increased in size. Let me say that again. Innumerable additional nodules are increased in size. A 2 centimeter right lower lobe nodule is stable to minimally less prominent from 2.1 centimeters, previously imaged 108. A 2 centimeter right lower lobe nodule is increased from 1.4 centimeters, previously imaged 72. There is no pleural effusion, no suspect osseous lesions. Abdomen and pelvis, ill-defined hypodensity in segment 4 adjacent to the fissure for the ligamentum teres may represent focal stenosis. A 6.4 liver mass is increased from 5.2 centimeters, previously representing metastasis. There is no biliary dilation. The gallbladder, pancreas, spleen, and adrenal glands are unremarkable. There is a 6.1 centimeter right retroperitoneal mass abutting the right kidney, increased from 3.9 centimeters previously, in keeping with metastasis. Right kidney is otherwise unremarkable. The left kidney is unremarkable. No hydrophenosis bilaterally. A 1.2 centimeter omental nodule is new, series 3, image 205. A 1.5 centimeter peritoneal nodule is also new, image 224. There is no ascites. The partially opacified bowel is unremarkable. The urinary bladder and prostate are unremarkable. A metastatic right external iliac lymph node measuring 2.2 centimeters is increased from 1.6 centimeters, previously series 3, image 286. There is no left pelvic or retroperitoneal lymphadenopathy. There is a 6 centimeter mass in the medial right groin, increased from 3.5 centimeters previously, representing metastasis. Series 3, image 322. This is inseparable from the adductor musculature of the right thigh. A vague sclerotic lesion is present of the L3, stable from August 6th, 2018, and nonspecific. No new destructive osseous lesions are seen. One more time. A vague sclerotic lesion is present of L3, stable from August 6th, 2018, and nonspecific. No new destructive osseous lesions are seen. All right, as I mentioned, we had came up with a handful of questions we wanted to ask, and we wrote them down to make sure that we would not forget. Some of those questions were, to be more specific, how long would Opdivo once a month continue for? Next question would be communication. How do we know that you are receiving info, confirmation, and agreement with my local on doctor's notes? Mutation gene CDK4, drugs to inhibit mutation, clinical trials. What kind of trials are available for that? And then also altitude and exertion. So, I was planning on doing a snowboard trip, which I did in March. Treatment and everything I was doing was going to have an effect on me, and if I was going to be healthy enough to go on that trip and still have a good time. And then finally, TIL therapy. Note in portal dated December 4th, 2018. Tumors not resected for TIL. If any areas of disease that could be resected, we'll ask the doctor or the surgeon to evaluate for TIL harvest. Okay. Again, to go over clinical trial, CDK4 mutation based on imaging results. Would like to discuss, and I told them I definitely wanted to be on a list for any of that. And again, I mentioned this is the first time I heard of ACT or adoptive cell therapy, aka TIL therapy, and what would be other treatment options. All right, so that pretty much kind of covers it for this episode. Wanted to keep things to a decent amount, in terms of creating these and then uploading them. The longer I make each episode, the longer it takes to upload. So the shorter I can keep them and on track and to the point, the better I can move forward with continuing everything. Okay, so up next for episode 11 is going to pick up from meeting with my medical oncology specialist after I just, had all these scans and tests, and meeting with him to go over everything, for him to kind of let me know what's the plan. See you on the next one.